Hi, I'm Dr. Doug Gumas. In talking to my patients, I found that there wasn't a solution which allowed them to combine the benefits of pneumatic compression with cold therapy. That's why I developed the Knee Cold Compressor. Whether you're an athlete looking for a quick recovery or a post-operative knee surgery patient, you'll enjoy a more comfortable recovery with the Knee Cold Compressor brace. It's perfect for the relief of chronic pain, helps with post-exercise swelling and soreness, and is a vital part of post-surgery rehabilitation and is used by athletes to help with their recovery. The brace includes one reusable gel pack and comes in one universal size. It's easy to use too. Once you've frozen the gel pack for at least 2 hours, you'll place the gel pack into the brace, making sure the seams line up over the kneecap. Grasp the knee splint and locate the valve on top. Place the opening over the affected kneecap and secure the 2 compression straps to desired fit. From there, you'll attach the tube with the bulb to the valve. Switch the valve to on and inflate the brace to the desired compression. Once you're done inflating the valve, switch it to off and remove the tube with the bulb. It's easy to do. Once you've done it, you'll be on your way to achieving pain relief.
For other patients who need additional support, the Knee Cold Compressor also includes 2 stabilization hinges and strap extenders. The hinges are easy to apply. Simply attach one hinge to each side of the brace and tighten the brace with the strap extenders.